I'm Karen Sparrow. I work for Peak Vision. I ran a discussion workshop and it was about what's on your smartphone that can help you with eye health. So as an optometrist or a dispensing optician, what apps have you got downloaded onto your phone that will help you in your day-to-day job? But also, what is it about that app? Is that app evidence-based? Who created it? Is it valid? Is it calibrated? So, a little bit of sense checking what we've got on our phones. And also thinking about our invisible patients. We all know, and we know very well, the patients that come into our practices and into our hospitals, but we don't know the patients that never appear. How do we reach out to those patients, and how do we adapt what we do in eye health in order to be able to serve those patients? So you don't want to take your big fundus camera or your computerized eye chart. Maybe there's a portable version. So we also talked about who are those people that are invisible to us, and that might be homeless, those with learning difficulties, it might be the elderly in care homes, it might be refugees, it might be somebody who has difficulty with a language problem or just doesn't know that the eye services are there because perhaps they've come from another country. There might be those in prisons. I know some optometrists and opticians run services for prisons. I would hope that after my workshop, people would think about all of their patients in their community. So not just the people they see, look at their community as a whole and see how they can extend their healthcare, their eye healthcare out to everybody. I am an optometrist. I did a master's in public health at the London School of Hygiene and Tropical Medicine, and that led me into the field of public health, having volunteered for Vision Aid overseas for many years. Peak Vision is a foundation, it's a registered charity, and the idea is to create impact in the eye health world in order to reduce vision loss and avoidable blindness. Now, mainly that's in low-income countries, so we're working in order to reduce vision loss in countries like Zimbabwe, like Botswana, like Pakistan, like Kenya, but also some of our tools are used by people in the UK. So I know practitioners who do domiciliary eye care and take some of our tools because it's portable, and also a consultant in Kent who, when she's on call and her registrars and trainees ring her up and say, I've got a patient in the ward in a bed with poor vision in one eye, she says, yeah, but what is that vision? What is the measure of that vision? And so they pull out their phone and they do an acuity test with a patient that otherwise they wouldn't be able to bring a logmar chart into, or they can't move the patient to the ophthalmology clinic. So they're actually using those tools at the bedside. So the tools are very useful for everyone, but we concentrate on taking eye care access, eye health access to the most inaccessible, the most remote places in the world where there isn't really an eye health system, and then help and support districts, hospitals and governments to strengthen their eye health system. So very much looking at what they have and working with what they have, but also showing them where some of the gaps are, showing them where some of the problems are, which they can then solve. Our Peak system was used first in Kenya, and Dr. Rono in the north of Kenya in a little town called Kitale runs an eye hospital. They have now screened something like 300,000 children. Those children are getting eye care, and they're getting their spectacles, they're able to see at school. We're also running community eye health, so in Zimbabwe, in Mashonaland West, they have just started a community eye health program, so we're reaching the adults as well and connecting them with services so that if they have diabetes, they can get the eye care that they need associated with that. If they have cataracts, they can get the surgery. And if they just need a pair of reading glasses, which we wouldn't think twice about in the UK, just getting somebody a pair of reading glasses can make a difference to their lives.